Hello dear doctors and implantologists. This video is for you. Placing an implant on the posterior maxilla is always a challenge because of the two reasons. Number one is the pneumatization of the sinus, which limits the length of the implant and tempting you to place a shorter implant. Number two is the quality of the bone. Mostly it is a D3 or a D4 quality bone. So if we could add a millimeter of the implant extra, that would be fetching an extra osseointegrated surface area for the implants, which helps in the longevity of the implants. There is a technique called sinus bypass where you need not augment the sinus membrane or reach out into the membrane and place a graft. The simple technique is bypass the sinus, go a little palatally and place an implant so that you will be able to place a very longer implant compared to a normal implant if you place vertically right under the maxillary sinus. And more the length of the bone, more is the surface area integrating with the bone, giving a better osseointegration for the implants and hence the teeth. We will look into one such case where the availability of the bone was very less and see how we managed and gave a longer implants. If you look at this posterior left segment, you've got 11 mm of bone height. But if you could bypass the sinus, we can place a much longer implant compared to the available 11 mm. We are placing around 18 mm implant bypassing the sinus. Similar case, we can see it on the first quadrant where the availability of the bone is around 9.5 millimeters. And we want to place a longer implant, so we bypass the sinus and place the longer implant which is palatal to the sinus, and we place again another 18 millimeters of implant. That is pretty big and long implants which helps in a much more higher level of osseointegration and helps the longevity of the implants. For more videos like this on dental implants and implant surgery, kindly follow Dr. Presley Thomas.